Here at Pulse for Pulse, we place the patient's prevention at the primary point of our interest in taking care of that patient. Pulse for Pulse has developed an algorithm that is embedded within a software program that will actually tell you if you have silent peripheral vascular disease. Good afternoon, everyone. This is Mary. She's our medical assistant today. We have Patrick who's our patient. I'm Dr. Phil Mangaluzzo, and we are about to perform 3 different tests through Pulse for Pulse. So our first test is the autonomic nervous system test. You can think of the autonomic nervous system test simply as a balance of your nervous system. Very simple. When you get scared, maybe if you've been cut off in the highway, your heart starts to race. That's your sympathetic nervous system. The other thing this tests for is your parasympathetic system. When you eat a large meal, you get tired and you want to fall asleep. So that's what this test does. And it's primarily based on a couple of different parameters. As we go through this test, you'll see Patrick go through a couple of different maneuvers, standing up, bearing down, sitting back down. What this test is something called heart rate variability. The best way to explain heart rate variability is that when you run up the stairs, your heart rate needs to pick up. It needs to beat faster so that you can get more oxygen to your muscles, to your legs, to your arms. If that doesn't happen, that can be a problem. And that's one of the things that this test tests for. That is called cardiac autonomic neuropathy, one of the many things that we'll go over at some point later in discussion. But that is a very important thing, again, based on heart rate variability. People that have diabetes, people that have high cholesterol, people that even have hypertension, sometimes their ability to pick their heart rate up during exercise is compromised. And that is a problem that we need to find out. That's what this test is for. When you can't find that out, it's a silent issue, meaning that we don't know that it's there. And if you don't know it's there, and your healthcare practitioner doesn't know it's there, that could be a problem for you. When we identify it, there are a number of ways to treat it. So as you can see, Patrick is set up here. He's got a blood pressure cuff on his upper arm and his lower legs. So what we're doing now is we're going to check his blood pressure in a sitting position, and later we'll test his blood pressure when he stands up as well. Again, all about the aforementioned heart rate variability that I spoke about earlier. A really unique way to find out if there's a silent problem. See, one of the things that I love to talk about in my own practice is preventative medicine. What we're really after is asymptomatic disease in the asymptomatic patient, meaning silent disease that hasn't manifested itself. Wouldn't it be great if you knew there was going to be a problem 5 years from now or 2 years from now? And I always use this analogy. When you build a house, you want a strong foundation. You want to make sure there's no cracks in that cement. Because if there are, and there's a leak in your basement, you'd rather know about it on day 1 than day 5 years from now. And what this test does is it allows us to quantify silent disease. We are allowed to pick up very small blood vessel disease before it ever becomes a problem. In medicine, we're really good at a couple of things. We know how to treat reactively for sure. Someone comes into the hospital with a heart attack, someone comes into the hospital with a stroke. We know what protocols to run. We know exactly how to treat them. We know how to treat them aggressively so that they survive. What I want to ask you is, imagine if there was a way that we could identify small blood vessel disease the same way we identify large vessel disease. So that's the difference between microvascular, meaning small blood vessel, and macrovascular disease, meaning large blood vessel. Again, very good at determining when someone has a heart attack and how to treat them. Not very good at determining the 5 years prior to a heart attack. And that's one of the things that this test helps us to risk stratify. So right now, Pat is having his blood pressure taken. You can see the screen. There's an EKG tracing up above, which is right here. And then we've got a couple pulse wave velocities going on, and it just allows us to look at the blood flow between his upper arm, his heart, and his legs and his heart. And based on this and an algorithm that's been written within the software, we're able to identify if there's a problem with the autonomic nervous system. So while Patrick is deep breathing, I will just tell you, when you take a deep breath in, it increases the intrathoracic pressure inside of your chest. It actually will compress the heart. So it's a way to measure heart rate variability under stress. So what I mentioned before in terms of having your heart rate change as you run up the stairs or as you meditate, same way, right? So if we're running up the stairs, our heart rate should pick up. If we're doing something relaxing like meditating, Tai Chi, sleeping, our heart rate should drop. So this is measuring his autonomic nervous system from a heart rate variability, and that really is the backbone of the autonomic nervous system. So what you just witnessed is Patrick really doing an amazing Valsalva maneuver. That really holds pressure in the intrathoracic cavity and really pushes on the heart. How that differs from is just his deep breathing. So when we breathe, we have respirations, and our heart rate should change with respirations. Again, going back to the running up the stairs or running a marathon. The faster you run, the heavier you breathe. You want your heart rate to pick up, but sometimes that's not the case. That's one of the things that this test can pick up. When Patrick had that Valsalva, it really increases intrathoracic pressure, putting a lot of pressure on the heart. So we're measuring his heart rate variability, or the ability from pulse to pulse, to see what happens, to make sure that the changes that are happening are appropriate. In this next segment, Patrick is actually going to stand up from a positional change, again looking at heart rate variability. So as you see Patrick standing, this really is a very interesting part of the test for me, and I could talk about this for hours. But what I will say about this is extremely important. When you're sitting down, you don't need a really high blood pressure to perfuse your brain because you're sitting and you're relaxed. The moment we stand up, or the moment we get out of bed from a lying position, a lot of things have got to happen correctly in our body so that we don't get dizzy or pass out. So when we stand up forcefully and quickly, blood pressure tends to pull in our legs and not go to our brain. We need blood pressure in our brain. That's called brain perfusion. Without it, you'll get dizzy, lightheaded. So this tests for something called orthostatic hypotension. Yet another thing that the autonomic nervous system tests for. If it is present, it alerts us that there could be an issue and we need to work that issue up. So in a normal individual, what we would expect when they stand up is that the blood pressure stays stable and it does not drop, and the heart rate stays stable and does not drop. Because the body is smart enough to know that it needs to vasoconstrict or tighten the blood vessels in the lower extremity to send blood back up towards the brain. So that's what Patrick was just demonstrating. So as you're seeing the tracing on the system here, one of the things that we always caution patients about is not to worry so much about what the blood pressures are reading, because we are so used to getting blood pressures in our arm, and we're so used to numbers like 120/80. The blood pressures in the lower extremities will be different, so I always caution patients not to worry. What we'll do with this test once it's complete is that we will be able to take the ratio of the blood pressure in the ankle and actually put it over the blood pressure in the arm and see if there's an issue. As I said earlier, literature has stood the test of time back as far as dirt was made. If there is a problem with that number, it's very easy to ascertain. And then the next step would be looking at that blood pressure in the leg more carefully with an ultrasound. So as you can see, Mary's preparing Patrick for another part of our testing. So now just move the blood pressure cuffs to the opposite side that was tested previously. And so this is just the left side of Patrick, so it's just a repeat from the segmental vascular analysis as we go through the same parameters that we just spoke about in terms of taking blood pressures at the arm and blood pressure at the ankle. And it'll give us a number, and that number, again, as I said earlier, has stood the test of time. Once we complete the right side of the body, we'll then test Patrick's left side of the body. Remember, we'd love to be mirror images, but sometimes what goes on the right does not necessarily mean what's going on the left. You can have a normal ankle brachial index on the right, meaning normal blood flow, and the left can be compromised. That's why we test both. The importance of this is if there's compromise on either side, we need to start looking for other disease patterns that also mimic peripheral vascular disease. This testing, as we see, has many clinical benefits, but probably the most important, the one clinical benefit above all, is that it will help diagnose asymptomatic disease. Now we're going to start the third and final portion of our testing, called the pseudomotor testing. This perhaps is my most favorite component of the testing. Pseudomotor testing is important because it will actually test your sweat glands. As Patrick is shown here, he's got his feet and hands on glass plates. There'll be a small electrical impulse that will go through the palms of his hands and the soles of his feet. Patrick won't feel it, but what that does is stimulates the sweat gland. And it doesn't matter if you're 10 or 100, doesn't matter if black, white, yellow, green, orange, red, or violet is your favorite color, we all have a characteristic sweat response, and that has a voltage tag to it. That voltage is measured in this test. If that voltage is abnormal, you have a problem in the smallest blood vessels of your body called microvascular blood vessels, or you have a problem in the smallest nerve fibers in your body called microneuropathies. That is a silent disease pattern. You will never know that it exists, not at this level. It's one of the things that our testing tests for and alerts us to a potential problem. So as you can see the screen here, Patrick is now undergoing this test. One of the parameters that we test for because of the electrical impulse, if you have a pacemaker or a defibrillator, you should alert your technician to that because you will be skipping this part of the test. So what if there was a way now that we could actually look at the smallest blood vessel problems in your body from an arterial standpoint, or the smallest nerve problems in your body? We would be able to identify asymptomatic disease. That's what Pulse for Pulse does. We are much more interested in the asymptomatic patient with asymptomatic disease because we know that today that patient is healthy, or so it seems. But in 2 or 5 years, that patient may not be as healthy as they are today. And our test helps determine what other testing may need to be done. In simple lifestyle modifications, if there is an underlying vascular disease issue, simple lifestyle modifications, walking, can improve their health so incredibly. Medicine has changed a lot in my last 20 years of doing this. We are stressed with so many different priorities now to care for the patient, insurance issues, prior authorizations. We've really lost touch with why we went into medicine in the first place. This makes me a better doctor and will make those doctors looking at it, those healthcare practitioners that are mid-level practitioners, it'll make them better practitioners because it allows us to uncover silent disease. Prevention is where the key is in today's day and age in medicine. And we need to be able to identify today if there's going to be a problem in the next year. Think about it. If I was walking around and I knew I was going to have a heart attack in 2 years, I think I might take some precaution today. I would change the way that I eat. I would change the way that I exercise. I would change the way that I treat my body. We need to become better doctors. We need to uncover more truths. We need to uncover those hidden truths that we don't know. It's far too hard to do that in a 15-minute visit. But through our preventative screening, we do that for the doctor. And that will allow him or her to become a better doctor.